Okay, we're ready.
Hey guys, welcome back to We Met at Acme. I'm so excited to be here with Mary Alice and Dr. A of the SheMD podcast. Hi, ladies.
Well, it's so strange for me to be in New York and on the other side of Thais because we're always sitting next to each other, talking to before a guest comes. And so, hi.
Hi, cutie. I missed you.
And Dr. A looks amazing in her green, like elevated scrub. I don't know what that is, but if you created it, you need to like sell it.
I didn't create this one, but I've created other
That's how we
ones.
met,
And my
actually.
next
When
one-
I sort of she came to a podcast with Molly Sims' podcast I was co-hosting, and she walked in with these scrubs, and I was like, "Oh my god, I've never seen scrubs that look like that." And,
Never.
I've seen Fig and all.
Yeah,
You
right,
see those
right.
around, but these were sexy, chic looking things.
Yeah.
And I, former fashion designer, I'm like, I'm gonna blow this out of the water, and then instead, I decided to blow Dr. A out of the water and create a podcast and everything else.
I
So.
love that. And I'm so happy you did so that we're here today. We'll start with Dr. A on this one. What is your favorite romantic gesture?
Spending time with my husband without the kids and just the two of us, because that's an extreme rarity for us. We've never traveled without our kids. It's very rare. We might have done it twice. So even when I was in India this past weekend, we had 3 days together. I think it was the best time the two of us
That's
had.
so
And that is
nice.
it, literally first love, married the first love of her life.
Stop.
Yep.
Like a high school sweetheart?
So, not high school, but I met him my last year of. I was actually a third year in college at Berkeley. We met at Berkeley. He was my first boyfriend, and we've been inseparable. We have a blast, the two of us together. Sometimes I feel guilty, having so much fun without my kids because I love my children, obviously. But maybe like in the past 19 years, we've had 3 vacations, very short ones, just the two of us. And this last one was last weekend, and we had a blast.
That is awesome.
Yeah, for those that don't know, that was that amazing Ambani wedding that I went so deep in social media looking at the jewelry.
Oh, I
The
mean,
jewelry is something I'd never seen in my entire life.
we could do a whole episode on that wedding.
Totally
right
do
now.
on that wedding.
I want all the details. And Mary Alice, what is your favorite romantic gesture?
My husband and I whenever we travel a lot. He has to travel for work. I travel for work. I leave him little notes. So whenever we go, I'll sneak them into a suitcase, or sometimes he'll sneak them on my pillow. So that's something that we sort of do, just making sure that we know that, we love each other. And
That's really
yeah.
cute.
That's so
I love it
sweet.
so much. It's true.
And Doctor, I have to ask you, because for people listening who are doctors or in a profession where they're very busy a lot, like how does it work with your husband? And, I assume like your time with him is very limited because you're so amazing and dedicated to your work. How is he so understanding, or how does it, I imagine by now he gets the drill.
He does. I met him in college way before I went to medical school. So he's been with me every step of the way. And I'm honestly really lucky. I have the nicest husband on the planet. I can honestly say that. He's very understanding, very loving. And even when it comes to my husband and my children, I always feel like quality is more important than quantity. Because I work so hard, because I'm almost never home. When I'm home with my family and my children, there's no yelling, there's no screaming, there's no fighting. We never fight. It's always loving and kissing and hugging and, being happy together. And that's, I think, is more important. I used to have this conversation with my mother-in-law, who sometimes used to tell me, why do you work so hard? You need to be with your children. And when your children are little and you're raising them, I had a lot of guilt, because you always compare yourself to all these other parents who would do drop off and pick up and were always there. And I would miss every activity at school. But fast forward, now my children are 19, 18, 12. And of course, I have a little adopted daughter who's 3.5. But I have the most amazing children. They're so grateful. They love me so much, and they appreciate me so much, because all the memories they have with me are all good. There was never yelling. There's never screaming. So I think for me, one thing I've learned in life is, and I always say this to my working mom patients, I had this conversation last week with one of them. You start feeling guilty when your children are little, but as long as you're there and you're there for the most important things in life, and they, you teach them to grow up to be a good person, and you're loving with your husband, and you have a calm and loving environment at home. That's all your children need. So I think, to answer your question, he's wonderful, but I've learned to optimize the time I have with my children and to make sure they remember it as a beautiful moment. So, you know, and I think that made all the difference in our lives, for our life at
Yeah, I
least.
love that. It's so important how you spend your time. It's not important, you could have all the time in the world with your kids, but if you didn't appreciate it, then it wouldn't matter. But the small time that you do have with them, like, yeah, you optimize it. I think that's so important.
I also, from somebody that is divorced and have a great relationship with my first husband, but we had a terrible marriage
Mm,
and we fought and we screamed. And I am so thankful that we both had the wherewithal to know that that was not right and that that wasn't what we wanted to mimic to our children. And now we both have partners who are so much better suited for us. And we both have a calm life and a calm and love. And so sometimes with my friends who are contemplating divorces and they say, "Oh, I'm just going to wait until the kids go to college. I'm just going
yeah.
to stick it out." And I said, "That's not what you want to teach your kids. You don't
Hmm.
want to, don't you want to teach them that it should be happy and loving? And don't you want to show them what a real happy marriage is if you're able?" And I know some moms, are in a different situation than I was, but I totally agree with that.
Yeah. That
And
yeah.
I learned so much from Mary Alice. She has the best relationship with her ex. Sometimes we're in the car and she's like, "Oh, hi, honey. How are you? How are the kids?" I'm like, "Who are you talking to?" She's like, "My ex." I'm like, "What?" It's amazing. That's why her children are her children, because there's just so much love. That's exactly what I was saying. There's a very famous saying, I always use it. It says, children don't remember what you do for them, but they will always remember how you make them feel.
Mm,
So if I tell you to close your eyes and think of your childhood, automatically we always remember all the trauma and all the bad things. The one time our parents forgot to pick us up from school, we'll always remember that. And we forget about the 360 some other days that they would come on time. So it's always, remember, as parents, I go out of my way to make sure that those memories are always good and there's no negative memories, because children hold on to those negative memories. And I think what Mary Alice did is incredible. I mean, her and her ex are like a team, and they're raising these beautiful children. I mean, you should write a book
It's
about
really
divorce and
it's
how.
extraordinary. It's not that I don't block him sometimes on the phone. Not that we don't have our moments, but yeah, it just is it's so different. I mean, I've said this to Thais before. I was like, I'll never forget seeing him walk up the path and saying, "Dear Lord, please let him cheat on me or get hit by a bus so that I can get out of this." And then
mm,
he came to me and said, "We can't do this." And we were, so
yeah.
I think it was just weird. I say the biggest blessing of my life is my ex-husband.
I mean, it sounds like it.
Yeah.
I've always heard you shouldn't marry anyone that you couldn't like amicably divorce
Yeah.
because you'd be like scared that they
Yeah,
would go rogue
totally.
or, be mean. And it sounds like,
And at the listen, divorce is hard. It doesn't matter if you have the same, happy divorce like I did. Those first couple of months when you're figuring out custody and money and all that, it's rough. But if you just have, you just can't marry someone crazy. That's
yeah.
number one. And you have to try to. There's a reason that you fell in love with the first place, and you just have to try to think, uh, what would you want to do in that moment? How would you want that person to show up for you and try to
Hmm.
do that for them? And I think then you can get through it.
Yeah, that's amazing. And I'm also very impressed. I mean, I think the waiting till the kids go to college is the worst. I think it's so cliche. I think it's a terrible model and it happens way too often.
Yeah,
It's like, the whole grade get parents get divorced at the same time once
yeah,
everyone
totally.
goes to college. It's like, what's going on here? Like you were sad and depressed for that long?
Hmm.
Like that would make me so
Yeah,
sad as someone's
yeah.
child. Okay, so moving on from relationships, even though I want to talk about that with you guys all day, I feel like we have to utilize Dr. A for all the amazing knowledge that she has. Before we started recording, we're talking a little bit about PCOS.
Hmm.
And when you and I spoke on your podcast, we were talking about, my PCOS. And I'm very curious for you, Dr. A, when you diagnose with someone with PCOS, what is your typical course of treatment for them?
So that's a very good question. When you diagnose someone with polycystic ovarian syndrome, you have to look at their symptoms. Not everyone shares the same symptoms, right? There are PCOS patients who walk around and they really don't have the symptoms, or their symptoms are so mild it doesn't really bother them. You really don't need to treat them. But when it comes to polycystic ovarian syndrome, it's a group of symptoms. It could be acne, it could be hair loss, it could be facial hair, it could be body hair, it could be body acne, it could be obesity, it could be that they're overweight, it could be that they're infertile. So every patient gets treated based on their
Mm,
symptoms. There's not one size fits all for all these patients. So that's very, very important. There's a large spectrum. Some patients need it all, and some patients don't need anything. I will tell you though, majority of patients fall into the category where they have all the
right.
symptoms, from acne, hair loss, facial hair, body hair. They're overweight, they have depression, they have mood disorder, they have fertility issues. So you have to address all their symptoms.
So let's say that someone has all of the symptoms. What do you usually, I mean, I don't know. Again, I doubt there's a one size fits all, but let's say I come in and I have it all, I have everything. And in the next year, I want to get pregnant, but I'm not getting my period and I have all the symptoms. Then what?
Very good question. And that's majority of the PCOS patients. So basically, when it comes to fertility, obviously age makes a difference. As we know, PCOS patients have a lot of eggs, but their egg quality starts going down faster than other patients. And that's why it's one of the top causes of infertility on the planet. So I had a patient yesterday, with tons of eggs. She hasn't been able to get pregnant for 2 years. She had two miscarriages in 2022. And her doctor kept telling her, go try some more. No, you don't try some more. Your periods are irregular. And you have to understand, PCOS patients, even when they have regular cycles, those cycles could not, sometimes they're not ovulatory cycles, meaning they're not really ovulating.
Mm,
Their ovulations are suboptimal. So one medication that helps these patients a ton is a medication called metformin. I don't know if you've heard of it. A lot of these PCOS patients have insulin resistance. And even when they're thin and lean PCOS, they still have insulin resistance, and metformin will significantly improve their chance of pregnancy. Metformin, unfortunately, has some side effects. It has a lot of nausea, GI side effects, and that's why, with Mary Alice's help, we hired one of the top scientists on the planet, and we've created this supplement that will almost work equal to metformin for patients who can't tolerate metformin. But metformin is huge. Diet, low sugar diet is very important. As we know, PCOS patients are insulin resistant. So when they eat sugar and their body breaks it down into glucose, our pancreas releases insulin. The job of insulin is it opens up the receptors on the surface of the cell so it can grab the sugar, put it in the cell where it turns into energy. This process doesn't happen in a PCOS patient. When they eat sugar, and their pancreas releases insulin, these receptors are insulin resistant. That's a most simple way of describing it. So these receptors are not functioning to grab the sugar to put it in to turn it into energy. So sugar stays in their blood, pushes their insulin up. Insulin is a fat storage hormone. So as it goes up, it stimulates our body to basically take that sugar and store it as fat. So weight gain is a problem. And as insulin goes up, it stimulates our ovaries to secrete androgens or testosterone. And it is that testosterone that blocks our ovulation. So by lowering the insulin, right, we can lower the testosterone. And by lowering the testosterone, we can start having these patients have ovulations that are more regular. And that's how you get them pregnant. And the medication or the supplement, whatever will make patients more insulin sensitive, can help that. So low sugar diet is important. Exercise is important. That's why we tell diabetics to go for walks after
yeah.
they eat, because when we start walking after we eat, we open up these receptors and we pull that sugar in and we lower that insulin. Metformin does that. So lifestyle is very important, but majority of these patients will need
And
medications.
another medication that's really popular right now is Ozempic and like GLP-1s in general. And I know that it's been recommended for PCOS patients depending on their situation, right? How is
Right.
a GLP-1 different than metformin? Because I personally don't know.
Very good question. So I started using GLP-1s for my PCOS patients in 2014. I know you guys think Ozempic is new and these medications are new. In 2014, my own family members lost 60 pounds. So I've done this for many, many years. I don't think anyone has, very few people in this country has they've used it as long as I have. I mean, literally in 2014, but back then it was Trulicity. I was giving my patients, PCOS patients, Trulicity to help them lose their weight. And eventually these medications got better. It was Victoza, then it was Saxenda, then it was Ozempic, then it was Wegovy, then it was Mounjaro, then it was Zepbound. So they just got better and better and better over time. So these medications work differently. Number one, they suppress the appetite. So a lot of these patients don't have that. It shuts down that noise in our head that constantly tells you you're hungry and you want to eat. So a lot of PCOS patients do have eating disorders, so they obsess over eating. So this medication I love for PCOS patients because it just calms their mind and they're not thinking about food
And
all the time.
metformin doesn't
It
do that? Hmm.
Mm-mm. Metformin makes you more insulin sensitive. Some patients might have some appetite suppression with it, but nothing close to the
Hmm.
GLP-1s, nothing. So these medications literally shut down your appetite for up to a week. And that's why it's a weekly dosage. Some of them are daily, like Saxenda or Victoza. Then there's the pill form of it too. What were we talking about? Oh, the GLP-1. So, and not only it lowers your appetite, GLP-1s regulate your insulin, right? So they
And
do
that's similar to
affect
metformin.
your,
That's the similar part to
Hmm.
metformin.
so they're actually regulate your insulin secretion. Metformin is making us insulin sensitive, makes our body respond to that insulin, if it makes
Yeah.
sense. So metformin indirectly lowers our insulin, but the GLP-1s regulate the insulin and regulate our
I
appetite.
see.
That's why together they work really, really well.
Oh,
So it's not that you have to be on GLP-1 or metformin. I actually like patients to be on both of them, especially for PCOS patients
interesting.
or patients who are overweight and they're insulin
And
resistant.
then when do you advise someone who's trying to get pregnant to go off of these medications?
I usually say a month before, and I usually make sure that my PCOS patients are on metformin. Whether you're lean or not lean, you have to be either on this powder we're coming out with or metformin when you want to try for pregnancy. Believe it or not, lean patients respond better to metformin and they get pregnant super fast compared to the more overweight PCOS patients. So I put everyone on metformin. Obviously, you can, if someone has regular cycles and they want to try on their own for a few months, I let them try for 6 months. But if they're not pregnant, I usually recommend
Interesting.
metformin.
And where do you stand on birth control for PCOS patients?
So, birth control is very tricky, especially birth control pills. PCOS patients have mood disorder. They're moody people. They suffer from anxiety, depression. They're just moody. So, they tend to be more sensitive when you give them combination birth control pills. Now, a lot of PCOS patients also have endometriosis, uh, at least 40% of them. So, because of that, I tend to prefer using progesterone IUDs in these patients because it's not as systemic. It doesn't have estrogen. It doesn't affect their mood, and it doesn't affect their, they're not depressed or anxious on it. I have a lot of PCOS patients who are on combination birth control pills, but I can start them on it if they have symptoms of acne, hair loss, facial hair, body hair. But if I feel like it's affecting their mood, then I take them off and I either switch to a progesterone only pill, and even on that, something like Slin, even if they have some side effects on that, then I switch them to a progesterone IUD. Again, every patient is
Hmm.
different. You have to see what you're trying to fix, what symptoms they have, how sensitive they are. But generally speaking, PCOS patients tend to get a little bit moody with combination birth control pills. So I'm very aware of that and I'm very careful when I
Yeah,
prescribe
that
it.
makes sense. I'm so curious. And this actually came up. I was at dinner with girlfriends last night and I was telling them about this recording today. And I was like, I'm so excited. If you guys have any questions you want me to ask, like, I'll be your person. And my friend was a little nervous because her husband smokes a lot of pot. right?
Mhm.
And this is like more and more common, especially, in LA. And she was like, I wonder how much these recreational drugs like weed or even alcohol, right, play a role in your pregnancies and all of that, or like your hormonal stuff. And I'm wondering if you have any thoughts on those things.
Definitely, especially for men who smoke a lot of weed. We definitely, if I always, that's one of the questions I always ask. I always do a semen analysis. Not for everyone, but a lot of men, when they smoke heavily during the day, it can affect their sperm. So for those patients, before they start trying for pregnancy, I send them to a fertility clinic and I do a semen analysis just to put a check in front of it. So that I do. And for my patients who are trying for pregnancy, obviously, I'm more strict and conservative. So I say absolutely no drugs. Alcohol, I let patients drink socially while they're trying, but I have zero tolerance in pregnancy.
But for men, you think it's worse than for women? Is that because the sperm is like new every day and the eggs have like been there forever?
Yes, and we know that smoking weed does affect the sperm quality.
But
I
we
mean,
don't.
it makes
So, and
sense.
No, of
It's the
course.
same thing. It's always you told me the story once, which was hilarious. She's like, pretty much every time I have a couple that comes in and having a hard time, the husband's like, it's not me. It's definitely not
Yeah,
me.
yeah, of
For sure.
course.
It's not me. Like my sperm is perfect. But you know what I mean? Like it takes two to tango.
unfortunately, yeah, but unfortunately, they're almost always right. The sperm is almost always good. And I have these potheads that come to my office and their sperm is still perfect. But it's part of the workup. It's always good to put a check in front of it so you don't
Right.
send a couple for a year and then figure out that the sperm is not
Yeah.
good.
I feel like everything like PCOS, endometriosis, and breast cancer, which we're going to get into a little later, feels more prevalent now. And I can't explain why. Maybe it's social media and just the awareness, but everything, especially PCOS, feels like it is everywhere now.
That is thanks to Dr. A. Literally, she was the one, screaming from the rooftops.
Right.
But it is true. 75% of women with PCOS do not know they have it, and 20% of all women have it. So this is something that has been her life mission and something that we're doing on SheMD to really, educate women. And what did you say? You said if you could get every 18-year-old into your office, you would do away with fertility clinics.
I believe that. And I think what my friends and I,
You
no, go ahead.
No, I was going to say it's heartwarming when I hear you say, we hear PCOS and endometriosis. If you come to my office, short of begging, I literally beg these patients. I never beg patients for anything. I've never asked for anything from my patients. But as soon as they get diagnosed with endo and PCOS and they have a voice, I start begging.
Yeah.
And I have no shame because I feel like my patients sharing their journey has brought so much awareness to endometriosis and PCOS. With endometriosis, it started with Halsey years ago when she was my patient and I diagnosed her and I treated her. I went up to her one day and I'm like, I think she said, like, what can I do for you? I'm like, the only thing you can do for me is tell your followers if they have painful periods, it's not
Right.
normal. And then she started talking about it. Olivia Copo started talking about it. Tiffany Haddish said, and as more and more and more people started talking about it, I feel like we're still not there. We're still not there. We're not even close to being there, but we're years ahead of where we were even like 5 years
Yeah.
ago. Do you know what I'm saying? I had a conversation with one of the executives at Weight Watchers, and I was telling them, all of your patients are PCOS. I promise you. You just need to train your
Mm-hmm.
doctors to diagnose these patients because we keep obsessing over the obesity aspect of it, but we forget all these other symptoms that come with it, especially the fertility
Yeah.
issues. So, my dream is, and I've told this to Mary Alice so many times, I want the first lady of this country to grab the mic one day and talk about endometriosis and PCOS. I want PCOS and endometriosis to be a household name, and I will make
Yeah.
that
I
happen.
believe that.
Will
I
make
I know that you will. But part of why we've been talking about it and how prevalent it is because we're also a little confused. And I want your help, Dr. A, to tell us if this is true or not. Is it because we were all put on birth control when we were 14, 15? Or is it possible that it literally has nothing to do with that? And we've been having, these PCOS and endometriosis situations since like the 1800s and just no one knew.
For sure, has nothing to do with birth control. I was on birth control for 9 years. I got pregnant the first month I came off of it. The one thing to remember with birth control pill is a small percentage of women, when they stay on combination birth control pills, which suppresses our ovulation, they can have a chronic suppression of their ovarian reserve and ovarian function. So if you are listening to this podcast and you've been on birth control for I do egg count on everyone who walks through my door. I don't care how old you are, and I follow it every year because I want to make sure it doesn't go down. But if you've been on birth control for more than 5 years, you have to make sure you check your egg count. As long as your egg count maintains and it's not going all the way down, you can continue staying on that birth control pill. So birth control pill does not cause endometriosis. It actually suppresses it. Birth control does not cause polycystic ovarian syndrome. We're born with PCOS. It's in our DNA. So it's not, and a lot of patients have, let's say, endometriosis and PCOS. They go on birth control. Their symptoms are masked for many years. They come off of it. They can't get pregnant. They blame the birth control. It's not the birth control. It's the underlying condition that was missed in the first
But
place.
how can you get an egg count while you're on birth control that is accurate if you have PCOS? Because didn't we say that most of the eggs are no good?
No, that's not true. Actually, PCOS patients have a lot of eggs, but the quality starts going down a little faster. So for my PCOS patients, I start having the conversation for egg freezing at around 28. I want them to freeze it. Usually with other patients, we let them go to 32. I think the younger you are, the better quality and the better, the number and the quality is better. So I'm a little more aggressive on the spectrum of egg freezing. So I start having that conversation at age 28, especially with my PCOS and endometriosis patients. Some endometriosis patients, I have a 18-year-old in my practice. She has endometriosis, and her egg count is the egg count of a 40-year-old. If she was not my patient, she would never be able to have children, ever with her eggs. So it's important to diagnose these conditions early, do an egg count so you don't miss these young girls with low egg counts, because you can start freezing at 18.
You can't do it earlier?
No. They're too young.
Well, because that was going to be my next question, which is what can we do with our daughters to make sure we get ahead of these diagnoses? But I guess what we can do is bring them into your office when they turn 18.
Don't bring them to my office. I'm teaching you what to do. So
that's why we started the podcast, literally, because everyone can't go see Thais. So it's like we want to arm you with all the information so that you can be your own health advocate for yourself and for your daughter. So she literally, it's step by step by step. This is what you should do if you have PCOS. This is what you have to do if you have endometriosis. This is what you need to do so that you don't get breast cancer. It's the whole reason for our why.
Yeah.
And going back to your daughter, listen to your daughter. If your daughter is doubled over in pain, wanting to miss school, not go to school because she has so much pain, don't dismiss it. Don't ignore it. Women get dismissed. Their symptoms get dismissed. I had a girl with advanced stage endometriosis. Her anatomy was completely, it was so devastating. This girl would end up in the emergency room every time she had a period for 2 years. I met her when she was 14. Her teacher told her, "You're doing this not to come to school." That's how women get dismissed. Her mom called after I operated on her and fixed her. Her mom called. She said this is the first time after 2 years she had zero pain with her period, and she went to school. So it's time to listen to our young girls. Do not dismiss their symptoms. If they have painful periods, you have to assume it's endometriosis and treat. You always assume the worst, treat, so you don't get in trouble when they're 30.
Believe women. And Mary Alice, you mentioned breast cancer, which is a good segue because I wanted to talk about breast cancer and specifically the BRCA gene. Why does that also feel more present than ever? And like, how important are these news stories that are like the tap water is giving you cancer, breast cancer, and all of this stuff? I mean, is that just fear mongering? I hope.
I don't think anyone knows what causes cancer. I had breast cancer. I've never smoked. I've never done drugs. I don't drink alcohol. I've never been overweight. I never did hormones. I don't have a gene mutation. I don't have family history of cancer. I got breast cancer. So there's so many factors that can probably affect us: our food, our cell phones, our stress levels, all of it, and we're all different. Um, I'm glad again, breast cancer is become more common and more people are talking about it because it's the top cancer in women after skin. So it's very important. We need to know our breasts. We need to know what to do with it. I want every single person on the planet, every woman on the planet to know her lifetime risk of breast cancer, because once you know what that risk score is, you know what to do with it, right? And that's how Olivia Munn, I thought, she brought so much awareness to breast cancer. She came on our podcast, and I feel like she started a revolution in this country and around the world, which I'm forever grateful for. But breast cancer, BRCA, I want to make sure people come to my office and they're like, well, I don't have BRCA. We don't care about BRCA. Great. You don't have BRCA? Great. 5% of women with breast cancer have a gene mutation. The rest of us, the rest of people who get breast cancer are exactly like me. They have nothing and they still get breast cancer. So it's always good to remember that majority of women who get breast cancer don't have it in their family. If you have it in your family, then you want to take the BRCA test. But BRCA is only 2 of the 48 cancer-causing genes. There's some labs that check up to 98, but 48 of them have been really strongly associated with some form of cancer. So if you have family history of cancer, you want to do in my office, I do the MyRisk Myriad cancer gene test, and you can do it in saliva. You can order it from home, or you can do it at your doctor's office. It's a blood test. They run 48 cancer causing genes, and they tell you, in addition to those genes, whether or not you have tiny little markers for breast cancer. These are markers that are not part of these 48 cancer causing genes. For example, BRCA1 and 2 are part of the 48, right? But there's other gene mutations like P10, PALB2. These all cause breast cancer, but they're not BRCA. So you want to do a full panel gene mutation if you have family history of cancer to make sure you don't have it. But Myriad also looks in your DNA for tiny little markers. These markers individually don't do anything, but if you have tons of these markers in your DNA, it can push your lifetime risk up high. These are patients by history. You calculate their lifetime risk, it can come back 18%. And then suddenly their MyRisk test score comes back at 28% chance of breast cancer. This discrepancy tells me they have a lot of those tiny little markers that, we need to be careful with. And as soon as your lifetime risk of breast cancer falls 20% or above, then we know that you fall into the high risk category and you need mammogram, ultrasound, and MRI as early as age 30.
So we should take that test earlier than 30. And then if we have markers, we should get like a mammogram and more things post 30.
Right. And the other thing is, if you have family history of any cancer, take the Myriad test at age 25. By 25, you should take it. Why? Because if you have one of these gene mutations, let's say you test positive for BRCA1 or 2, you have to start breast imaging at 25, not 30.
Right.
So that's why it's important. I don't like doing it under 25 because, there's nothing we're going to do about it. But of course, if I do a breast exam and I feel a lump, I'll still work it up. You can't say, oh, you're 24, you're not going to get breast cancer. I've had a 22-year-old with breast cancer in my practice. So you always have to do an exam, always biopsy if you feel something. But if you have family history of any kind of cancer, take the Myriad MyRisk genetic test at 25 so we can plan ahead.
And we can order that test to our own apartment.
It can come to your house.
Okay, because I'm like over here 33 with no testing so far and freaking out. But
and on our site we have a free. The risk calculator is free. Like we wanted everyone when it came out with Olivia, and then we have a link to the MyRisk too, and it goes directly to them. And we have nothing to do with it. This is her other life mission, is to make sure every woman is armed with knowledge. And I think, to answer your question, is it that some of this is false information. And that's why I'm so glad that you asked her the question about birth control. You're asking her the BRCA. These are all small pieces of the puzzle. And is it because we're talking about it more and we're getting more knowledge, or is it because environmentally it's being raised? There's no
Right.
answer to that. I mean, one of
Mhm.
my best friends in LA has lymphoma, and it's been a year, and we're finding out today after she's done treatment, crazy treatments, if her scan, and there's no reason she should have cancer. There's no reason Dr. A should go. I mean, this friend of mine was the healthiest person that walked the planet. I mean,
Right.
there's no rhyme or reason for cancer. We just know that it really affects so many people. So, being your own health advocate and arming yourself with this information is the best way to make it happen.
Totally.
And when it comes to cancer, early detection is
It's everything.
huge. Want to diagnose your cancer stage 1 and 2, and that's the reality of it, right? So we're just giving you all the tools, especially when it comes to breast cancer, to at least do the imaging if you're high risk. So God forbid if it even comes, it's an early stage and we can
Right.
And the
fix it.
same thing with
You know,
PCOS. We're going to launch in September. We're going to have a PCOS calculator. So you're going to be able to go on, put your symptoms
Yeah.
on. We're not saying, this is definitely what you have, because legally we can't,
Yeah.
but we wanted to arm women again, totally free. Go on there, figure out if you have it, and then decide what your course of action is. And we'll,
Mhm.
it's the more information we can give women to be empowered, the more powerful they can be.
That's so helpful.
Can I tell you, ladies, something? My daughters go to Stanford and they're studying tech, and I always tell them this. They wanted to go to medical school. I'm like, don't go to medical school. You know why? Because these robot doctors, I love them already. They're not going to dismiss women. You're going to give them your diagnosis, and the robots are going to be trained to diagnose you correctly. Go on Chat GPT and say, I have painful period. My doctors say I'm okay. What's my diagnosis? I bet you $1 million you're going to get endometriosis. And that's why I'm so excited about this artificial intelligence. People are upset about it. I'm excited. I think it'll change medicine completely. Women will no longer be dismissed when robot doctors are going to
And
start
how
assessing
sad is
us.
that?
It's sad. That's terrible. But you've also said
It's not
we
No,
sad.
I mean, it's
It's
just
not
sad
sad.
that it has to be a
No, that it has
robot
to
to
be
get the truth, as
exactly.
opposed to like a doctor who should be telling us the truth up front.
I know, but you know what? These robots are not going to miss anything. I was reading a story of this little boy who had a diagnosis. The mom had taken him to so many doctors and no one could diagnose. Finally, she comes home one day and she punches all his symptoms, and Chat GPT diagnoses him with this rare condition. He Googles that condition, finds the doctor specific to that condition, takes her son there, and of course that was the
Wow.
diagnosis. And that's the beauty of artificial intelligence. I am so excited
Wow,
for
that
it
is really
because
amazing.
I'm heartbroken. I've spent 23 years seeing women get
Mm.
dismissed. There's not a single day in my office that I don't get a woman who's crying because she's infertile, because she doesn't have eggs, because she's had chronic pelvic pain, because she's PCOS and has been dismissed all her life, because she's, has a breast cancer now and she had high lifetime risk and no one did anything. All of that will end.
You
Wow.
better go on and do your lifetime risk. I'm going to make
Oh,
you when we
I'm
get out
going
of this
to. What do you think I'm
podcast.
doing after this? My last question on the breast cancer front is, let's say I have a BRCA gene. Let's say I have BRCA2. Are you advising me to, if I have the means, to do IVF to get rid of this gene? Or do you think it's okay for it to pass on?
100%, 1000%. If we're talking about pregnancy, I would absolutely force you to do that.
And if,
I-
let's say I do this, are you also advising me to get a double mastectomy before I'm 40?
Usually the guideline is by 40, we want your ovaries out. With BRCA2, I think it's 27% chance of ovarian cancer, and I think it's 84% chance of lifetime chance of breast cancer. A lot of these come after 40. I've had patients with BRCA2 that had stage 3 breast cancer at age 35, even though we were watching them triple negative. It comes very aggressive. So I say if you're done with your children, if you're done breastfeeding and you're 35, 36 and you have a BRCA2, take your
Yeah.
breasts off. I have no
Yeah.
problem with that. But ovaries, for sure, by 40, they need to come out, for sure, because we have no way of screening for ovarian cancer. And you can have a completely normal ultrasound today and 4 months from now have stage 4 ovarian cancer. It's a very, very tricky situation with ovaries.
Yeah. And I want to fit this last one in about female hair loss, which is very real. I mean, I'm going through it because I'm postpartum and
Well,
I'm
you have
starting to.
PCOS.
Yes,
That's a
and
symptom.
PCOS.
Yeah.
Totally. But I think this is a postpartum thing because I'm on
Mhm.
birth control,
Mhm.
which I'm hoping was helping
Yeah.
with the hair retention, but then it's also whatever, shedding from
Yeah.
postpartum. But for female hair loss, what should we do? Do you believe in the Nutrafol / Wellbells of the world? Do you think it's a PRP thing, or are we going to an endocrinologist?
I think when it comes to hair loss, obviously you have to do a full hormone panel. You want to make sure your thyroid's okay, or your testosterone level, your DHEAS level. You want to make sure your hormones are fine. Usually we do have hair loss after any traumatic experience. Like if we go through trauma, usually within 3 to 4 months, we experience a lot of hair loss. Childbirth, hormone changes, very, very common. PCOS, thyroid disease, menopause. So there's some of it is genetics. So when it comes to hair loss, supplements are very important, but sometimes supplements alone are not okay. I sometimes I myself take minoxidil. Some people use Rogaine on their head. I don't like using Rogaine because it makes the hair oily, and the maintenance of it is really difficult. I rather take a pill. Dutasteride is another pill patients can take. PRP, I've heard mixed reviews on PRP. I've had doctors who do it all the time who tell me it doesn't work. So I wanted to do it for myself, and a very good friend of mine who's a plastic surgeon, he said, I do it all the time. It's not going to make a difference, which brings the question why you're doing it.
Exactly.
So I've never done PRP, but I have patients who swear by it. I think nothing works better than the combination of minoxidil, dutasteride, and the supplements.
Awesome. I know we have.
And of course, stress.
Yeah,
Stress.
and get rid of your stress. I know we have a hard stop, so I'm so sad to be ending the podcast, but can we end with a piece of advice from each of you? It doesn't have to do with medical stuff, with PCOS. It could just be life advice, dating advice, whatever it is.
I will
Start. Good. You start.
Be your own health advocate. If something doesn't make sense, question. If you go to 10 doctors and they dismiss you, go to the 11th doctor. And now with the world of ChatGPT, put your symptoms in ChatGPT and see what the diagnosis is, and then start searching physicians who specialize in that specific diagnosis. But definitely be your own health advocate, especially if you're a woman.
I think one of my big pieces of advice to everyone is find your purpose. And when I met Thais, at 52 and having had a huge career in a completely different industry, and having sick parents and all of that comes with that, I really found my purpose. And it really is. And when your purpose can also be so you get to hang out with this badass woman that I get to hang out with all the time, but really helping other people. I don't know. It just felt, I loved being a fashion designer. I loved the creativity. I loved it. But I get to wake up every day and know that what I'm doing is helping so many women out there. And I don't know, that's my purpose. And I feel so blessed to have found that.
Yeah, that's an amazing thing. Thank you guys so much.
Thank
Where
you
can
for
everyone
having
find you? And stay tuned for the PCOS supplement and all of the
Yeah,
things.
it's called OV. It's going to come out in September, which is PCOS month. If you want to go to our podcast to be your own health advocate, which we really think you should, go to shemdpodcast.com, and then you can listen on, Spotify, everywhere, Apple, you name it. So we're really excited.
Awesome. Thank you so much.
Thank you for having us.
I miss you,
Mary
Alice.
Alice.
Bye.